Oh, so how do you say this name?
Nicole Scherzinger.
Scherzinger?
Scherzinger. Pussycat Dolls.
Zinger.
Loosen up my buttons.
Isn't that a food, zingers?
Yeah, zingers are...
Like Twinkies?
Oh, I thought they were like chicken wings.
I don't know. Hi, I'm Dr. Gary Motykie, and I'm a Beverly Hills board-certified plastic surgeon. And today we're going to talk about Nicole Scherzinger. I got that right?
That's correct.
Nicole was the lead singer in the group Pussycat Dolls, but I think that they're broken up now. And then she was also a judge on The Masked Singer. She's around her mid-40s, 43 years old. She's a mixed ethnic descent. She's born in Hawaii, I think, and she's part Filipino and part Ukrainian. So she has an interesting mix of facial features. So I want to talk today a little bit about, she posted some recent photos and people were suspicious that she might have had some work done. So we're going to take a look at her face and see if we see any changes that might be surgically induced. Before we jump into looking at her face, just a quick comment since we're talking about plastic surgery. I think it's pretty obvious she probably had a breast augmentation at some point as well. The rest of the body, I don't see major changes. So I think today we're going to focus a little bit more on her face. And I think we'd start out in her past surgeries, it looks like she probably had a rhinoplasty. She had the typical kind of more Filipino, Asian featured nose where it had a little wide, kind of flat in the bridge and a bulbous tip with wide nostrils. And then we see her later on where her nose changed. It got more defined and narrow in the bridge. The bulbous tip got more defined as well. And the nostrils came in a little bit. And all that's not just going to happen naturally. So she probably had a rhinoplasty at some point along the way to bring in and, like I said, narrow the bridge of the nose, define the tip, and bring in the nostrils. Why don't we get into what the commotion's about? And that's a recent photo that Nicole posted, and it looks like her eyes have a more cat eye shape to them. She's also in the photo kind of pulling her hair back and her makeup's done and maybe over exaggerated. And is it just makeup? Is it just her pulling her hair back, or did she do surgery? If we're looking at her brow, one of the things that makes it suspicious that it's probably more of a lateral brow lift or kind of like cat eye surgery is that the tail of the brow is really lifted up. So if it's just makeup, usually that brow won't get as lifted, it'll still have that arch. But when we see in her picture, it's really pulled to the side and that tail of the brow is really lifted. And that's usually a giveaway that something like the cat eye or lateral brow lift was performed. Other things that could add to that or could have done similar things but not quite as dramatic would have been threading in that brow area, but I don't think it would have given as much lift to that tail of the brow. So again, I think most likely very suspicious for that lateral brow lift. Although we're paying a lot of attention to her lateral brow in Nicole's face, I think that one other thing we should be looking at is the rest of her facial features. And I definitely think some other things have been done there. The typical things, probably doing Botox and skincare and those sorts of things, but also some facial fillers. You can see that her face, kind of in the mid-face underneath her eyes, has been softened and filled up a little bit. And her lips, of course, have also gotten a little bit bigger, and they don't just get bigger on their own. So I think she's, adding those little things in along the way, doing the facial fillers and the Botox and just kind of maintaining her beauty. And then I think the lateral brow, people notice that because it's a little more dramatic change. So all of these things have kind of added up in her face, that given her a little bit more of that dramatic, exotic look.
I'm not really a fan of the new look. I feel like it's too extreme. Like the brow to me seems like really, really lifted and looks unnatural, especially comparing to the way she looked previously. If we proceed with the assumption that she had a brow lift, does that mean that her brow will always be that lifted, or is it possible that maybe she's like kind of recently recovering from surgery and it'll settle down a little bit more?
Yeah, I think a little bit of both. One of the things about brow lifts versus like threading would be more temporary and would kind of slowly come down over time. But with the brow lifts, they're more permanent, so that's why I caution people before going in and doing the brow lift, make sure you really want it. Maybe play with the threads, some other things, because it's not going to settle a great deal over time. Now, if it's really fresh and just done, it may settle a little bit. And I think, again, I agree with you that I don't like, when it's really extremely overdone, kind of like the Bella Hadid look and the really pulled cat eye look. It might work with her again. And in this case as well, it kind of works a little bit with her, but it's when somebody of different ethnic backgrounds may not work as well. It may look strange or odd or overdone. In her, it is a little bit overdone right now, but hopefully it settles. But she's lucky because it's kind of works with the rest of her features, whereas in somebody else it may have looked really extreme or really out of place.
And then just being devil's advocate, if let's say this was like a combo of PDO threads and Botox, approximately how long would those results stick around for?
Well, months, right? So months to at most a year. It depends on the amount of threads, thickness of the threads, different things as they dissolve. You know, Botox and those things, you're probably looking at 6 months, maybe 9 months at the, you know, in generally speaking. So they would kind of settle down and you'd see some of that dramatic look going away. So again, it's something where people want to play with it and see if they like it. And like, oh my God, it's too much. They can slowly let it, you know, come back down to where it was before they messed with it.
Last question is, I think Nicole's 43. Is that like an appropriate age for a brow lift, or do you typically see patients doing it a little bit older or even a little bit younger?
All the above. So, I mean, the thing about a brow lift was developed for anti-aging, right? It was developed for people as the brows get heavier to lift the eyes and take away some of that tired look and open them up, make people look more rested. But now people are using more for facial reshaping, so people are doing it younger, people are doing it again for this cat eye look and not necessarily for anti-aging, but to actually change the shape of the brow and the face while they're younger.
Cool, that's it.
Yay.